My name is Kayana, and I'm a part time pharmacy technician at a major retail pharmacy, and I'm also a part time graduate student. When the pandemic first became widespread in the States, I think one of the biggest concerns for everyone was if they were going to be able to keep their jobs and what exactly it meant and continue to mean to be an essential worker. And right away, fortunately, at my job, we did know that we were essential workers. Um, but one of my concerns was that those with seniority would take precedence due to the reduction in our hours. But thankfully, um, all of us were needed just as before. Another big concern of mine during this time is not having health insurance. I haven't qualified to be on my parents' health insurance for a while, and because I am um, part time at work and part time at school, I do not qualify for insurance through either of those, which is very frustrating. And because of this part time status in insurance, I have had to be more cognizant of staying healthy during this time. And in the beginning um, of the pandemic, staying healthy was more difficult because one thing, it took months for us to be provided with the appropriate PPE at work. And with working at a pharmacy, we are constantly coming into contact with people that are sick, first of all, and a lot of people were coming into the pharmacy without masks because they hadn't been mandated yet. And now those that are testing for COVID or testing positive for COVID are coming in to get their medications. And although we have the appropriate PPE now, we do offer testing at our location. And so this has become a constant and more risk of exposure for us to the virus. Essentially, I feel like it's a catch-22 situation because, like most other healthcare workers, we don't have the option of working from home, but we work our same hours and we need to provide for our families and pay bills at the same time. But also, we feel that we're not very protected. I do have a coworker whose main concern this whole time has been bringing COVID home to her family because her children do have pre-existing conditions that make them more vulnerable to the virus. But at the same time, she has to come to work every day and experience that exposure every day because she feels as though she cannot take the time off to provide for her children. She has to come to work in order to um, give them, you know, provide their needs. Unfortunately, I did end up testing positive for COVID. It was not through work, but through, everyday interactions as we all experience. And another big concern that came up for me was that it could get bad because I am a Black female and I realized that um, those people of color, we have been more susceptible to getting the virus, and it has gotten worse for us. And one thing that I have had in the past is a vitamin D deficiency. And having that deficiency um, makes me more susceptible to not fighting the virus as easily as someone that has, normal levels of vitamin D and normal levels of other immunity boosting vitamins and things that help you fight off the virus. And again, not having insurance, so I can't see a regular doctor. It's more expensive to be hospitalized. So it brought on anxiety and not knowing what was going to happen at work. The minute that I did test positive, my pharmacy manager said, "You can't come to work for 14 days." And there was really no other conversation of what would happen with COVID pay or with taking time off because I didn't have that many hours, sick hours from being part time. So it was concerning of how am I going to pay the end, this month's bills or the end of this month's bills. And um, it just makes you realize that there are some disparities that need to be addressed. And I think that's one thing that this pandemic has shown us all, especially in the healthcare community, that there are disparities that we need to talk about and address to, make everything more equal and more fair for those that are suffering.